Kegels don't work.
What?
Kegels were made in order to make you feel like you're doing some kind of exercise that's going to help you prevent peeing your pants, and they just don't work. Our moms, our grandmas, they've all done Kegels and they haven't worked for them. So why do we think that they are going to continue to work for us? The reality is most of us have shortened and tighter pelvic floors, and we need to work on utilizing the full range of motion of the pelvic floor in order to get our power for our core. So I want to teach you how to do a reverse Kegel. So it's an anti-Kegel, and you're going to figure out how to do this with your pelvic floor in order to get you more range of motion. And once you get more range of motion, your pelvic floor will be so much more powerful, and you'll be able to hold your pee, sex will feel better, orgasms will be a lot more attainable. A lot of times people struggle to have orgasms when their pelvic floors are really tight because they are starting in this shortened position, and so if they have to get here to have an orgasm, they don't have much room to attain that climax. So when we can fully relax and open up the pelvic floor, then once we get that contraction, we can have that orgasm. But if you're already contracted, it's really hard to find that orgasm, so people have to work really, really hard for it. So we want to work on doing an anti-Kegel or a reverse Kegel, which is lengthening and opening up the pelvic floor, which is gonna help give us more range of motion and power of our pelvic floor. Now you might be thinking, but I feel like something's falling out, or I feel like I'm peeing all the time, so I need to constantly squeeze, squeeze, squeeze. That is not what we want to do. The reality is that the pelvic floor is a bowl. And if your bowl is really, really tight and you have a grape in your bowl and that grape is your bladder, the tighter the bowl, the more it's gonna squeeze the grape or squeeze the bladder. We have to relax the bowl and relax the pelvic floor so that the bladder has a room to move, and so we're not squeezing the urine out of it. So I'm gonna teach you how to do that today. Number one, we're gonna do a release technique of the pelvic floor, and then we're gonna follow it and do a reverse Kegel or an opening of the pelvic floor. All right, thanks for joining me. I'm Dr. Allison Felt. Here we go. The first thing I want you to do is to either find a pool noodle or to roll up a towel or a sheet so it's the size of a pool noodle, and then you're gonna stick it right between your legs. So here's my pool noodle. I'm gonna stick it right between my legs on a hard surface as I'm sitting up nice and tall. Now, in order to start releasing some of the superficial muscles of the pelvic floor, you might already start to feel, oh, that's a good pressure. It kind of feels like a foam roller, but for the vagina. And really, you're using it to help relax these pelvic floor muscles and open up these pelvic floor muscles, which is gonna give you more range of motion and more power for your pelvic floor. So if you're sitting here, and if that's not working for you, then use that roll up a towel or a sheet and stick that right there. And then you're gonna sit up nice and tall. And if once you feel like either the burning sensation is gone, or you feel like, okay, that pressure has decreased, then you're gonna lean forward and you're gonna try to find a new spot on that pelvic floor that needs to be released. Once that is better, then you're gonna lean a little backwards. Okay, nothing back there, feels okay, fine, then you're done. So this is a release for the superficial pelvic floor muscles. The pelvic floor is actually 3 layers of muscles, of fascia, of ligaments, of nerves, of blood vessels, of lymphatic system, and we need all of them to be able to move inside our body. Most of the time though, we all end up with these really tightened pelvic floors that are kind of cement-like in nature, and then the pelvic floor itself turns to more of like a beef jerky texture. The more motion we can get that pelvic floor, the more that the texture is gonna change to like a healthy chicken breast or like a nice juicy steak. And so that is a healthier muscle. Okay, so now that we have these release techniques down and you've just released your superficial muscles, we're gonna work on doing a reverse Kegel and drawing our attention down to these muscles so we can help open up these muscles further. So you can remove the objects and the props and now just sit your sit bones on the hard surface. And I want you to feel those sit bones, so make sure you're sitting up nice and tall on those sit bones. you're gonna draw your attention to the vagina itself or to the anus. Now, if you were to squeeze and do a Kegel, you would feel those areas narrow and you might feel your sit bones come together. Well, we want to do the opposite of that. We want to help open this area. So you're going to take a nice deep breath and think about opening the vagina or opening the anus to help improve the range of motion of the pelvic floor. Again, this is a core exercise. We're going to use our breath to help open up these areas. So you're going to take a nice deep breath into the belly. Take a nice deep breath into the belly. And as you inhale and the diaphragm goes down into your belly, you're going to imagine the pelvic floor opening. And as you exhale, you're going to imagine everything narrowing again. So you're inhaling, sit bones are flaring, anus and vagina are opening. Exhale, you get some nice recoil. Now, this is the mechanics of how to do a reverse Kegel or how to do an anti-Kegel. And so we're inhaling and opening. Exhale, you automatically get the recoil. No one needs to try to do a Kegel because we already are in that shortened Kegel state. So we need to work on getting the power by getting the motion of overstretching. And this is also how you should have a bowel movement, but I go over that in other videos that you can follow here. But this is how we're gonna do it. So you're gonna inhale and think about opening, and then exhale and let it go. You wanna do at least 5 breaths like this every single day. Ideally, do that for 5 minutes. You can do it while you're sitting at a stoplight. You can do it while you're laying in bed. You can do it in all different positions. And the more different positions you do, actually, the better, because then you're going to start to get control of these muscles. So this is the secret to not doing Kegels, but to having a very strong pelvic floor. So start incorporating these into your life. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy, located in downtown Edmonds, Washington and Poulsbo, Washington. And we have people fly all over the country to come here to help improve their pelvic floor function and get rid of all the symptoms that drive pelvic floor issues and just help them feel really, really healthy so they can be whatever type of 80-year-old they want to be. We are in the pursuit of helping women live active, strong, confident lives and avoiding things like bladder surgeries, knee replacements, joint replacements, sciatica, just staying as healthy as humanly possible. And we do that through helping people have really strong, powerful cores through their pelvic floor and through their bellies with very minimal exercise. So once you get control of these areas, you are going to be set up for life. I'm Dr. Allison Felt. Please like and subscribe to this video. We are so glad you're here and we can't wait to help you be the healthiest version of yourself. Take care.